So, welcome to Delhi Docs, Dr. Monali. Thank you for coming.
Thank you.
So, अभी
Thank you, Dr. Naman, for inviting me.
अभी तो किसी ने ज्वाइन नहीं किया. I'll just tell you क्या प्लान किया है. एक तो first we'll ask I will ask the question on research. ठीक
Sure,
है. और वीजा एंड कुछ क्वेश्चंस जो लाइव आएंगे उनको ले लेंगे. और
sure.
कुछ क्वेश्चंस मेरे पास और भी हैं from our previous comments and previous जो emails आए थे उनसे.
Sounds good.
Okay.
Sounds good. Yeah.
So let's start. हाँ जी. Okay. गौरव गर्ग is saying finally. Anyways. हाँ यार थोड़ा सा लेट हो गया. So why is research important for US?
Right. So I would say this specifically for general surgery residency. So, like in non-surgical specialties, it might not be as important, but for general surgery, I've seen that there's a lot of reluctance towards hiring or employing international graduates right off the bat. Like we are we just crossed, we just passed our MBBS. We haven't had that much experience, and in US, like they have a longer duration of med school, so they are a little bit ahead of us in age by the time they are getting into residency. So a lot of things together. I think for surgical residencies, they specifically want to see that you have invested your time and energy into understanding how the surgical kind of department works in US, how the surgical residency works in US. You have had a little bit of exposure, you have had a little bit of experience, you have some research under your belt, you have had like some mentors, some good contacts. So all of those things I think can be taken care of by different methods, some of them being observerships, clerkships, which are like shorter duration, kind of shadowing of a particular consultant or an attending in one of the US hospitals, or being a part of the team. But to me, it seemed like I wasn't the kind of person who could, like, just go and impress somebody in 15 days. These are like specifically 30 days or
Oh,
45
okay.
day kind of stints. So I did my observership at University of Miami, and actually a lot of people from our batch were there at the same time. Abhishek Gadre was there as well.
अच्छा,
So
in the same university.
yeah,
Wow.
we were at
Nice.
University of Miami at the same time, and Nidhi was also there. So three of us were there at the
अच्छा.
same time, and we were staying at the same place as well. So we used to
Wow.
travel to University of Miami together. So
हाँ.
yeah, so to me it just seemed like I wasn't that kind of person who could just, like, impress somebody and get like a good letter of recommendation in just a month. So my sister, who's a scientist over in US, she suggested, why don't you get into the research route? You get to learn the research part as well, and you'll have like a longer duration to kind of put your foot through the door. So after
Okay.
I can say this in retrospect that after doing a 2 year research at Mayo, 1 year in cardiovascular surgery and 1 year in general surgery, I think it was really important, not the surgical part, the research part, yes. Definitely, I got to learn a lot of new things, how to do research, understand about it. There are statisticians over there, so you get to learn about the statistics, statistics part as well.
Um,
But other than that, having a long-term contact with people over there, not just the surgeons, but the whole surgical team, the residents over there, the fellows over there, the other OT staff and everything. Because during my research, like I also used to get invited to the OTs to scrub by the
so
consultants or
you
the
were having
attendings.
clinical experience as well as research
Yeah.
experience, but
So clinical
primarily research.
experience, primarily research, because my research was the topic of my research was a few procedures like cardiothoracic procedures. So they used to invite
Mhm.
me to the OTs to observe it. So I used to scrub just to observe, not really, because as a research a personnel, you are not allowed to do any clinical work, because in general, like you are only supposed to either observe or shadow, if you haven't been like ECFMG certified. So you can't really be doing clinical work per se, but yeah, they used to call me to like scrub. So I'm just telling you, you get exposed to like a lot of people, right? So
Mm.
you get to know about how the functionalities, and also, like, those people can always be those kind of people who can like
Mentors.
put in mentors also, and they can put in like good words to your attending, and they get like a 360-degree feedback from everybody, and they can write you a good letter of recommendation. which is, I think, the most important thing. Like to get into a US residency, especially a surgical residency, having good contacts, good contact letters, good letters of recommendations from those contacts who can pick up their
Okay.
phones and make a call, to a residency program about giving you that position, I think is extremely important. So in surgery, like we talked about a little bit in our YouTube video as well, which was liked by so many people, that I'm sorry, I lost my chain of thought. Would you
Yeah,
like
it's
guide me
okay.
once again?
Even I started reading the comments. But yeah,
Sorry.
that happens on live stream. But anyway, so I got the gist. So to
Yeah,
get into a surgical residency, I need to
right.
somehow get the letter of recommendation. And if
Good
if
letters
I'm
of
not the
recommendation.
guy who can really impress in a short while, then research route is a good route. Is
Yes,
what
and
I got.
yeah, especially if you're somebody like me who wants to do like spend a good time of good amount of time to be able to show your work, to show your worth,
Mm.
to kind of have the attendings trust you, to build that kind of relationship. I think if you are kind of me person, like that would be a really good way to go about it. I know for other people as well who are like just like a little bit of people with like who are still are people who are a
Um,
little bit of like shine, they can just go and charm people. I'm not one of those people. So for me this route was important, and that also exposed me to like how a surgical residency works in US, how difficult it is, and all of those things. So kind of gave me a reality check as well for 2 years.
ठीक है. And what are the like? There are so many different terms around research in US.
Right,
There is research elective. There is
right.
research observership, I think, and then I don't know. You please elaborate the kind
Yeah.
of opportunities available for research.
Right. So I think more or less they mean the same thing: research electives, research fellowships, research
Yeah.
observerships, clerkships. All of them, they mean the same thing. They just have like different kinds of duration based on what your conversation with the attending or your mentor was or your supervisor was. So, like for me, it was like a 1 year kind of thing that my mentor suggested at that time, that you can come over here, we can work for a year, and it was an unpaid position. So again, that's kind of like a big disclaimer that if you haven't had a lot of research experience on your own before going to US, I think
Mm.
getting a paid position right off the bat is again not something that you
Okay.
would be getting like very freely. So all these research electives and everything, some, I think only a few programs they have like a official observership or clerkship or research elective or research fellowship kind of programs. But
Okay.
everywhere else it's more like informal thing that you reach out to the person who is doing some research work and you tell them that you have been through the research, this is your area of interest, and you would like to work with them. So it's, for me it was mostly that, like reaching out to people.
But did they pay
uh,
you?
so
Did
for
they
the
pay you?
first year, no. So when I was doing my research in cardiothoracic
Okay.
surgery, I did not get paid for a year, not even like the basic minimum where I could just afford my own accommodation or anything. I was basically on my own for 1 year with a lot of help from my family, of course. So
Mm.
that 1 year was difficult, but then after the 1 year was getting over, and I still did not think that I was ready to apply for the residency at that time because I felt like I needed to do more. So
Okay.
then I had applied for like some paid research fellowships at Mayo itself, but in different departments. So I applied in general surgery. So there, my mentor, Dr. David Farley, who is an amazing person. So he's really looks out for like international graduates. He had a lot of international graduates in his team as well at that time. So he was kind
Hmm.
enough to kind of interview me and then take me on his research kind of team on a paid position. So again, I think once you are there, na Naman, once you're there at the place, I think it's easier for you to like kind of show your worth and like ask for a paid
Right.
position and all of those things. But if you're
And
coming
find
right from,
opportunities. Yeah.
yeah, correct. And then even then you can tell
Absolutely.
them that okay, I can work for like 2 months for an unpaid position, and then I would want to
Mm.
get it converted to a paid position. So those kind of
Mm.
things, I think once you are there, you have the foot in the door, then it becomes a little bit easier, I think.
Right. So, what would you recommend a young MBBS guy? Like somebody was asking, he was in third year MBBS.
Right.
Artish, I think. Yes. So,
Okay.
do you think they should do research as well in India, or just straight away apply for research in US, do MLE? So, what should be the order? Like when to
Right.
do really, when to do research.
Right. So actually, that's a really good question, and I can answer that only in retrospect. Like when I was
Mhm.
doing everything, it just seemed like whatever I was doing was okay. But in retrospect, I can say if you're especially applying for a a surgical residency program, I would strongly recommend that you start building up your resume as I mean, whenever you can, even as a third year medical student, fourth year medical student, if there are opportunities for doing some kind of research, some kind of field work, which I did when I was an MBBS student and even after completing my MBBS while I was a JR. So I think having those kind of things in your CV, in your belt, I think that helps. So even after you have finished your MBBS, I think putting in like a year of research at India has amazing recognized places like ICMR is there, which does a huge amount of
Right.
research, and that research is not like the usual. I'm sorry to say, but like the thesis work in our PG, which is
Mm.
like mostly eyewash. So it's not
Mm.
that kind of thing. It's like well established research. There are some of the other groups that are available if you want to get involved in research. Something that's upcoming is what's called global surgery, which is like basically a newly coined
Acha.
term for global surgery, for rural
Okay.
surgery. So India
Okay.
has a lot of rural surgery that already happens. So globally, they are kind of trying to rebrand it, saying it's global surgery. They want like because more surgeons, more workforce, more personnel working in like out in the field in the rural areas. So being involved in that part, if you're especially interested, so that would kind of make you stand out because you are from India. You will be doing something which not a whole lot of people do. You will be working
Mm.
on the field, doing research on the field. So I think those things, whichever things that make you unique, whichever things which you think not a whole lot of people would have on their CV, would make you more amenable to like a residency program. That being said, uh, I know that the research in India is kind of seen down upon. I have experienced it myself on a few occasions in places like US and other Western countries. So
Mm.
might not be that helpful. So I would say spend a little bit of time here, but then also have like plans to go to US and be a part of their their research workforce. So that would definitely be there. Like I wouldn't say that you spend lots and lots of time in India for that. I mean, you can if you're interested, but if you're, I'm just talking about strictly from the lens of getting into a surgical residency in US. But I do know that they appreciate the kind of things which like the field work, the research you have done.
Mm.
Those things are appreciated.
So, okay, so you have covered already why research is important because it helps you to get into the residency,
Right.
surgical residency, and what you can do if you are in India and not there yet. But now, tell me how to apply for research positions in US. Any research, paid, unpaid, anything.
Right.
How do
So
you
that is
get there?
actually the most frequently asked question to me over the last few years. So I want to
Okay.
start off with saying that I applied for the research positions like by cold emailing. So I used to, let's say I went to like website of Stanford University. I found out some general surgeons. At that time, I used to be interested in GI surgery, HPB surgery. I mean, I still am, but at that time I was really
Mm.
interested in that. So I used to find surgeons who are working in those specific areas. Then I kind of used to search them on PubMed, what are their publications, and what
Okay.
are they working on. And then kind of just at यार MBBS के बाद इतना एक्सपोजर तो था नहीं, तो ऐसा नहीं था कि मेरा कुछ बहुत ऐसा इंटरेस्ट लेवल था कि मेरे को इसी चीज में इंटरेस्ट है.
Mm.
बट एटलीस्ट लाइक अ लिटिल बिट ऑफ आइडिया कि मुझे एचपीवी में जैसे हेपाटो पैनक्रेटिको बिलियरी सर्जरी में इंटरेस्ट है, तो मैं उससे रिलेटेड कुछ देखूं. सो आई यूज टू लाइक गो थ्रू देयर रिसर्च एंड देन यूजली ना ये वेबसाइट्स विल हैव देयर ईमेल्स. Otherwise, like Google it. After a few tries, you'll find
Medical
their
councils
emails.
and stuff. Yeah.
Yeah, you'll find it somewhere or the other. So
Right.
then I
Even
used to start.
publications sometimes with the corresponding author. I used to do like that.
Right.
German emails, I would not understand their websites. I would go into the publications, find the
Publications.
corresponding author,
That's a
and
really good point. Yeah, because they always would have like a email for the corresponding author. You are right.
always, yes.
Always. So then I
So
used to
that
have
was
I
my thing.
no, I think yeah, that's a really good point. I don't remember if I used to do that or not, but I just remember I spent a lot of time just like getting emails of a lot of people from here and there, from the
Mm.
websites and yeah and wo. So then I had like a template made, because of course you can't like
Okay.
personalize every email too much, because I think I sent over 300, 350 emails before I got any
Okay.
response.
So
So I
what was
sent
the
like a,
ratio? What was the response ratio? How many did
so
you
I think
get?
I sent definitely over 300 emails, if not more. And I think the responses that I get, either positive or negative, was probably like 10 or 15, not more than that. And the
Hmm.
positive response was from two places. One was from Mayo Clinic and one was from University of Alabama, GI surgery over there. GI surgery at University of Alabama and cardiothoracic surgery in Mayo Clinic.
When I was applying for fellowship in Germany, I sent almost the same number of emails,
Yeah.
but thankfully, because mine was so particular, my subject, and I had a CV in India because this was after SRship. So I
Right.
think I got around 20
Okay.
responses,
Okay.
and 4 or 5 were positive. So even after specialization, the response rate is not great.
Yeah.
It's not
And
great, and
did you
that was,
also
and
do the same?
none of them offered a paid position. Everything, of
Ah,
the 4 or 5 positive responses, there was none offering. No one was offering a paid position.
paid
So
job.
yeah,
Right.
cold emails are okay for some opportunity. Yes,
Right.
definitely.
So to add to that, I know at that time also, like, there were a couple of programs. I forgetting the name. I can, I can look it up later on and send you a text so that you can share it with other people. Like, I'm sure some programs, they still offer like official research elective programs. Like, again, they could be paid or unpaid, but mostly the emails that I made, and I think what you also made, were like the unofficial informal ones, where you just send
Hmm.
out the email to the person. So I used to have like a template which I got it proofread from a couple of my people. So the template, and then the the research part used to change every time. And then also, since I was like very young, and I know us time pe hum log ye sab likhte the, I would be very glad, I would be very appreciative if you could just provide me one opportunity. I will come work like with, or even on an unpaid position, and this and that. If somebody was to ask me now, I would say, like, be a little worthy
Confident,
of yourself, थोड़ा सा
right?
confidence, और थोड़ा सा अपनी worth और बना के you just
I'll be
say
eternally grateful और ये सब
yes.
लिखने की जरूरत नहीं है. Forever, eternally in debt, ऐसा लिखता था मैं.
राइट, सो हम सब लोग वैसे ही थे, ऐसी अजीब अजीब सी चीजें लिखते थे,
Respected sir, ma'am.
सो
Yeah.
सो या
Even
लाइक इन
sir, ma'am
रेट्रोस
doesn't work. They don't really enjoy being called sir
या
or
यू
ma'am.
कुड, in US it's like doctor and last name mostly. Usually, you can just address it
Hmm.
like that, or you can say dear doctor and the last name. So usually that part works. So
Hmm.
yeah, so that was kind of the scenario. And I think even now, like a couple of years, 2 or 3 people had reached out to me. I had told them the same thing about the cold emailing, and they said that that's what they had been doing as well. But Taman, I just want to again put on a little bit of disclaimer that this is something that I followed. I'm sure the people have had like different kinds of experiences, that even without a longer research experience, they were able to get into a surgical residency and everything. But like I said, again, I'm a person who likes to like get a little bit of more time on hands to understand what is happening. So for me, this part was essential to kind of get into before getting into a residency over there.
Okay. So this is one way to do cold emails. Do you have any other
Right.
way? Do you know anything other than that?
So that's what I was telling you. Like, some of the programs, they have
Hmm.
official research electives. So they have like all their forms and everything. So you have to fill out the form. You have to like write which specialty you are
But
interested
that's
in, and this
individual
and that.
programs we
Yeah,
have to find out.
yeah.
So
I think
और
I think
कोई
there are few.
exam कुछ ऐसा
No, for
कोई
research there is no
combined, there
exam.
is one like some combined evaluation or something, nothing like that.
Not
There
for
is no
research.
organized system in place.
No. So, but there are I mean, I keep coming across these kind of academy kind of things on LinkedIn and everything, which are getting more common these days, where they have like, जैसे इंडिया में कोचिंग क्लासेस होती हैं, वैसी like
Hmm.
USMLE and everything के लिए they have like some sophisticated coaching kind of plans. There they help you
Right.
out with making your CV, to like getting your observerships, clerkships. तो उस तरह की चीजें I think available हैं, but like you'll have to
Okay.
research on the internet. But those kind of coaching kind of things are available where they help you build your whole CV, not just the exam part. They help you figure out कि आप कहाँ पे जा सकते हैं. And that being said, actually, clerkships and observerships are paid, meaning you have to pay the hospital to be able to do the observership or the clerkship. It's not the other way
Oh,
around. It's not even just like you could go do it for free, like you have to pay
oh,
for it. Yeah.
okay.
Like, so you have to
So
pay for your travel,
in
for your accommodation, and you have to pay a
wow,
fee for observing.
wow,
Yeah.
wow, wow.
Yeah.
It, it's a little bit off track, but when I was in Germany, the observerships, some of the observerships, or almost all of the observerships offered were free. Like I had to pay for my accommodation and those things, my
Right.
own khana pina and everything, but I didn't pay any. I didn't have to pay the hospital anything, or the hospital doesn't have to pay. But there was a caveat: if the observership is more than 3 months, then the hospital has to pay the minimum amount. This what an intern gets. If it
That's
is
how it
more
should
than 3 months,
be.
then the hospital is not allowed to
Yeah.
give you any observership or anything. Observership maximum 3 months.
I think that's how it should be, Naman. Like I stayed there for a year, like funding my own accommodation,
Too
food,
much, yeah.
everything. 1 year in US is crazy. That place is crazy expensive. So,
At least
after
15,
1
20
year,
lakhs. You must be somewhere around
आराम से
around
and then
15, 20
आराम
lakhs.
से and then बीच में like एक बार इंडिया का एक ट्रिप आना ही था because I was too homesick.
So,
I
right,
used to go see my sister who was living away at that time, so उसमें आने जाने में पैसे लगते थे. So it was like a lot of expenditure that ended up happening, and that was the reason at the end of 1 year they were offering me कि हमारे साथ 1 साल और कंटिन्यू कर लो. आई वाज लाइक कि मतलब मेरा खर्चा पानी कैसे निकलेगा यहाँ पे, तुम तो बोल रहे हो.
सही
And
बात
actually, I
है.
was a little desperate at that time. I don't know. I don't think a lot of people have told this, but I actually even applied in other specialties. Like I knew that there were some open research positions in psychiatry and a couple of other departments. So I had applied like everywhere. I thought कि position मिल जाएगी तो at least I get to stay here and I can still get to make contacts and
Right.
continue that process. So yeah, I mean for I think the importance is like getting your foot in the door, and I think then things kind of like they tend to work out in my
Okay.
opinion. Yeah.
And there is, so I think the main part is done, right? About research. Do you have anything else to add?
Yeah. Yeah, in the research part, I would also say that don't just take it as an opportunity to just like kind of create that relationship with your mentor. US has incredibly good research opportunities. Actually, like use it to learn research, to publish papers, because again, even if you don't get the residency over there, you still get to like have that kind of experience with you. If you have to return to India like I did, because I didn't eventually get a permanent position, I mean, I still have those kind of teachings with me. So I was able to, somebody's asking that if I had any prior research credentials. I actually
Mm,
did not. But after getting all that exposure of research, even when I came back to India, I am continuing to do research till now. So
nice.
don't just like use it. Even in US, like you might not get the residency at the same program that you are doing the research at, but whatever it is, like take it also as a learning opportunity, not just like kind of a stepstone to getting into residency.
Okay. So
Yeah.
that's very well said. One thing I would like to ask you, I could have asked you offline as well. And sorry to put you in a spot like this,
Nahi,
but
it's okay.
I did one podcast with Dr. Ravi. He's a neurosurgeon, which this podcast has not been released yet. So he also did his research something from Mayo Clinic, and he has, after his residency and after some fellowships, around 120 research papers, which is
Wow.
huge.
Wow.
And so he agreed for this. I asked him online if somebody from our viewers wants to understand research and has some questions, will he be able to answer them or mentor them for some
Right.
research projects? So I want to want to ask you the same questions. So you also
Yeah.
have a great Google Scholar profile. I have checked it out. You have good
Right.
H index and everything. Yeah, I know. And your maximum cited paper is, I think, from COVID.
Correct.
And yeah,
That is
so
correct.
if you are okay with it, then it would be great if you can
Yeah.
mentor some young, like really young resident or a MBBS guy, girl for research.
Yes. Definitely. I mean, at least for the research in India, I can help out. I currently, like, for those who don't know, I'm doing my residency in general surgery in Delhi. So I'm a little tied up with my own thesis and my own work, but I can at least point you towards the right resources, the teams that are already working. So I'm working with multiple teams in India. One is the trauma team, one is the emergency surgery team. So some of the teams I'm working in, I was more active on it before my residency, and I hope to be more active after residency. But
Nice.
I can at least point you towards those resources. I can tie whoever wants to
I think,
get involved.
yeah. I
Yeah,
think
I can
even
sign them up.
if you can help them even write a letter to editor, I think, or a case report,
Yeah,
I think that would be a good start.
yeah.
Or some protocol making. Okay, that's a little bit complex, but still,
No, even you're
even
right. Letter to
basic.
the editor. One of my very first publications was actually letter to the editor. That's like the
Yes,
simplest thing to do, and then kind of gives you a
actually.
confidence boost.
And to
Yeah,
write a letter to editor, you must understand the methodology at least. So it's
yeah,
not like ऐसे ही कुछ भी लिख दिया. You have to
yeah,
understand what's going on in the research. So
yeah.
I don't think it's a
Agreed.
bad thing, at
No, no,
least
no.
in
And
the beginning.
actually, I don't know if you know that the helical structure of the DNA that
Yeah.
was published by Craxton. What was his name? Vic.
Uh,
I'm forgetting the
Watson
names.
Crick. Watson Crick.
Watson and Crick. They
Yes.
actually the
Orthopedics.
first the the first time they published it was actually a letter to the editor. After that, after the letter to the editor was accepted, then they kind of like applied for the whole paper and
Wow.
everything. The first time it was submitted
Oh,
was a letter to the
I didn't
editor.
know that.
Yeah.
Interesting. Okay. So next step, next part of the live podcast.
Yes.
No, not podcast, live. Visas.
Yes,
So
my most
tell me.
stressful kind of thing when I was in US for almost 5 years. So for the
Hmm.
visas, we know that there's B1, B2 visa, which is like a visitor's visa that to the US. It's a 10-year kind of thing, 10-year expiry, multiple entry or single entry, depending on how you have applied and what is your purpose of going to US. So when you're going to give like some exam for USMLE, that is the visa you will apply for a B1, B2. That's a visitor's visa that you can also apply for if you're going to roam around and just like travel and meet
Right.
somebody. Then for the research part, and that also applies for the observerships or clerkships. Like you can go on a
Okay.
visitor's visa. For
Okay.
the research fellowships, research electives, which are longer duration, or for residencies, there are two visas that are available. One is the J1 exchange visitor visa, and the second one is the H1 visa. And H1 visa
Mhm.
is kind of like too much under the limelight right now because Trump has come in again and he's made a whole lot of changes to that again. So when I went for the research, they had offered me a J1 exchange visitor visa, which again in
Okay.
retrospect is not something that I would recommend. I would recommend that you kind of like bargain for an H1 visa and not for a J1, because J1 is a little bit of a complicated visa. You can be in the US only for the strict time duration that is mentioned on that visa. You cannot do anything else other than what is mentioned on the visa. So, like for example, when I was in an unpaid
Okay.
job, I couldn't like even work on the side to get like some basic amount
Oh.
of money or anything. तो बहुत सारे
Mm.
restrictions हैं, and then उसमें वो भी है कि once the visa ends, like you have to either come back to your home country, at least for some countries, and India is amongst them. You have to come back to your home country for 2 years before you can go back again to the US, or you
Oh.
have to stay in US and do and work for 3 years at an underserved area in US before you can apply for an H1 visa, which eventually you will apply for a citizenship as well if you plan to stay there in the US for a long term. So a little bit of complicated visa, but J1 visa is the visa that is most easily given by most of the programs because they don't have to sponsor that visa. Our government sponsors this visa because it's kind of like an exchange visitor
Okay.
visa. The H1 visa, which is kind of like the sought after visa, which a lot of like these um, management people who are going to Google, Microsoft, all these big companies, they are the ones who usually get these H1B visas. So for that, the company or the hospital that you are going to, they have to sponsor that visa. So that involves some expenditure on their part.
On their
I don't
part.
know the
Okay.
Yeah,
Okay.
on
Got
their
it.
part. So I don't know the nitty
Mm.
gritties of it exactly, but they have to sponsor like the expenditure. A little bit of it goes to the
Mm.
hospital, and then also like you kind of have to show that the person is in a good standing and this and that. So they kind of are taking a little bit of an ownership of the person that they are inviting. or
Right.
giving the visa to.
Some
So that's why,
responsibility.
so that's why lot of reluctance towards
Mm.
H1B visa. So when I was kind of struggling between like, I hadn't gotten a permanent position, but I had gotten this research position at Brigham in Boston. So at that time, I was frantically trying to, change my visa from J1 to either H1 or O1. Like there are other visas as well, but none of that worked out, unfortunately. But then that's kind of like
Okay.
the bad state you could be in. But that is just me. A couple of my friends are there. They were easily able to switch to H1B visa after their residency. Their program sponsored it. So right now they are attending in the US at different hospitals across the country. So it worked out for them. So I'm just saying it may not work out for somebody, may work out for some people.
Mm.
But if ever given an option, or if you, and even if not given an option, I would say that you kind of bargain to an extent to get the H1B visa, even for the research, because then it's just easier. Switching from J1 to
Right.
H1 is a task. And
Okay.
then you can't do your residency, or you can't do your permanent residency on a J1 visa. That's for sure. You will have to switch to H1B. And if you already have the J1 visa for your research, switching becomes like an additional hassle for the
Mm.
program or for wherever you are applying. So then it gets like very stressful. At least for me, I think I told on the YouTube videos as well that for me the
Yes,
visa
yes,
part
yes, I
was
remember.
particularly the most stressful part for me. So yeah, that's what my recommendation would be
And can
for
you
the
do,
visa.
so what can you do on J1? You can do observership, you can do clerkship, but can you do like
That you
real
can do
fellowships
that you can
on
do on the tourist visa
J1?
as well.
Tourist
B1
visa
visa.
as well. Even
Yeah.
be no, I mean like I know some of my friends who did their residency from India and then they went on fellowships and those were like real hardcore surgical fellowships in
Hmm.
US.
Hmm.
So that can you do that on J1? No,
You can. Those
you
can
can.
be done. Yeah.
Okay.
For the residency, for the those fellowships would be the non-accredited ones. They would be the ones who would go do the fellowships and then come back. They wouldn't
No,
be
if
the people who are
if they
practicing
want
over
to stay
there.
there, then they have to do
Then the program has to sponsor an H1B visa. If you
right.
have to practice in US, if you have to do your residency fellowship or become an attending, being on J1 visa is not an option. So like my friend, she was on the J1 visa for the residency part, but then when she had to switch for the attending part, she had to apply for the H1. And currently she is actually doing her that underserved area 3-year stint in the
Oh,
underserved
okay.
area. So after that, she'll be able to switch. So
Got it.
I'm sorry, I take my words back. Residency can be done on either J1 or H1, but if
Hmm.
you plan to switch to like a working situation, like become an attending or all of those things, then it needs to be switched.
Okay.
Yeah.
Got it. And so there is one question. Someone who has not qualified USMLE, what are his prospects of doing a dedicated fellowship in the USA?
So
Okay.
this actually, that's a good question. This actually I got to know recently from a colleague of mine who has joined our hospital in Delhi. He has told me, say now US, a couple of states in USA have come up with this prospect of having fellowships where uh, people who have done their residency from other countries can come do the fellowship and then actually continue as an attending, like even without doing a residency in US. But right now there's only one state. Again, I don't know the name of the state. I will give it to you after
But
the
without
live.
Emily, not
Without
without Emily,
giving Without Emily, they told me
without
that
Emily.
they're
Okay.
coming up with this fellowship. So you do a residency from your home country, you do the fellowship, and then you get to stay. And actually, this was being done earlier as well, because when I was at Mayo, I had met like a lot of very senior people from MAMC, and they told me that they
Okay.
did their residency and house job from India. They came here, did their fellowships, and since then they have been there. So earlier, also much earlier, it was that provision was there, but I think now it has been removed, but maybe it's coming back, it
Some
seems
oh
like.
Sarthak has replied Tennessee. Okay, in Tennessee
Yes,
probably.
Tennessee. Yeah, Tennessee is the
Um,
state. That's what I knew some South state, but yeah, I didn't know which one. So yeah, they are coming up with these things. So that could be something to look out for if you do your residency from India and do a
mm,
fellowship, and if you want to stay there. But overall majority still, you have to kind of do the residency from US. Even if you have done your residency in India, even if you have done like a super specialty and everything from India, like at this point, majority of the
You
states
have
in
to do
US, like
MLE.
yeah, you have to do MLE, you have to clear the residency, and then you get to practice.
Mm.
Yeah.
And then someone is asking, I wish to know what are the prospects in US after doing PG in general surgery from India. Okay.
Yeah, so I have one friend from Lady Harding who did her residency in general surgery from India, and then she applied to like for general surgery programs in US. She was able to match into one like the permanent program. She also like did 1 year of some elective, some
Fellowship.
research, you know,
Ah,
before she
okay.
applied for the residency, but she was able to get through. So like just from like anecdotal examples, I know a couple of other people. So I think doing residency from India kind of puts you at a little bit of a better place than having done just MBBS, and then applying for not just MBBS but like MBBS and then applying for residency in US versus having done your residency in India already and then applying for residency in US puts you a little bit of an edge. But I also know it works the other way around. If you're done your residency from India and everything, so they kind of are also like they want fresher graduates. That's what I was told when I was at Mayo and even in DC,
Mm.
that they want fresh graduates. I don't know why or whatever,
I think because
but
fresh guys can work harder. I think maybe that's why.
uh,
They
maybe,
don't have
yeah,
some tantrums or, they are better at following orders,
yeah,
mechanical
maybe.
things.
Maybe that's true, but
Yeah.
yeah. So like you kind of have to explain your years that you did after your graduation and everything. So
Mhm.
that becomes kind of a task. But from some of the examples that I know who did their residency first in India and then went to US, two people I know in surgical residency and the others are in non-surgical residencies. It just seemed to me as an outsider that they had a little bit of an edge over what I had when I went there right after MBBS. So yeah, I mean that
Right.
could be a better option, but then also you have to understand that then like you are definitely doing the same thing twice. So you have to be ready to like do it all over again, like be an intern again. Being an intern in a surgical program in US is actually equally worse as being a first
As
year
in England.
resident in India. Yeah. So
Ah,
it's not something like, so you have to do those things again. You have to do the scut work, you have to follow orders. So all of that needs to be
sampling
repeated for
everything.
sure.
Yeah, yeah, yeah.
हाँ. So उसके लिए
Dressing
ready
and
होना
everything.
पड़ेगा फिर. हाँ.
Mhm. I know, I know.
So
Yeah.
sometimes it could feel like कि वो 3 साल रेजिडेंसी करके भी इतना फायदा नहीं मिला तो मैं अपना टाइम क्यों वेस्ट कर रही हूँ या whatever. तो उस तरह की feelings आ सकती हैं. So you have to be ready for that.
Hmm. Okay. Yeah. This question I was thinking if you know about it or not. Research positions. This NIH funding cuts, but that's too
Yeah.
recent to have any opinion. I think. But do you have any
Yeah.
opinion?
I actually have an opinion because my sister, she's a scientist in US and a lot of her funding comes from, NIH because she's a scientist in artificial intelligence, but she also works in healthcare fields for that. So I know from her that it's too soon to tell, but it's going to cause like a lot of issues moving forward. But as far as I can see, like it's not going to change like the research opportunities as such. Because the
I also think so.
the
Yeah.
attendings and everything who are doing the research or the programs in the medical colleges or hospitals that are running the research programs, I think that will still continue. But the bigger grants and everything, so you have to apply for grants to like run like trials and everything. Those
Mm.
things might be
Core
uh,
scientific research,
yeah.
pharmacological
So like
research.
the
Yeah.
basic science research,
Mhm.
randomized controlled trials, which require a lot of money. But things like, मैंने जो करा था यूएस में जाके सबसे पहले those were like retrospective studies. All the data that was already there, I was
Mm.
reading that data. So those kind of opportunities, I would say, might not be
Right.
affected by
In fact,
this
they might
right away.
increase because people they would want free labor, right? पैसे नहीं
Maybe,
तो
maybe.
it
But then
could be
also
counterproductive.
counterproductive, but then also with Trump being like so restrictive about who can enter US or not, like again, like I think we still got like अभी बहुत टाइम है देखने के लिए कि क्या होने वाला है आई थिंक बट इट्स
Mm.
गोइंग टू बी डिफिकल्ट दैट्स व्हाट इट सीम्स लाइक I know of
Right.
people, again, like my American friends who are in US who are now struggling to get work because of a lot of restrictions that have been put up. I can only imagine कि
Okay.
जो वहाँ पे international graduates रह रहे हैं या जो immigrants रह रहे हैं उनके लिए कितना मुश्किल हो रखा है इस time पे.
Right. Okay, I think ho gaya hai. Okay, somebody has just joined. Can you explain briefly how to get research? Okay, I'll just summarize before we
Yeah,
finish. I
yeah,
think if somebody like Abitron, if I'm pronouncing it right. So what you said was why research is necessary, and I think just to get into surgical residency, just to know what's going on, know the system, understand, get a letter of recommendation, make some contacts, and of course learn how to do research. So for these kind of things, research is important. How to
correct,
get it is either cold mails, which is I think the standard way to do it, which most of us have done it like that, and I think that's one way. And the other way is to find out programs, specific institutes which are running such programs, and
right,
if they are willing to take you with your CV and stuff. So I
right,
think those two are the standard ways to go about it. And
yeah,
I think that's it. And of course,
yeah.
I'll repeat again, anybody who's interested in understanding research, anybody who wants some kind of mentorship, then Dr. Monali has agreed. So write us an email and maybe comment below this, or maybe comment anywhere on Delhi Dogs. I don't know, but we'll figure it out. And
Yeah.
yeah, we'll see.
So
I'll
if
let you
guys
know.
like, yeah, there are a lot of research opportunities. Like I can tell you off the bat that बहुत सारी चीजों के लिए बहुत सारी research जरूरी है क्योंकि Naman, like a lot of data that we have is from Western literature. It doesn't fit into our own
At all.
Indian population at all.
Absolutely.
So
Absolutely.
like at Apollo, they are currently looking at the aortic dissection and aortic aneurysm. Like the aortic dissection that happens, it happens at a certain diameter. So in general, what they've seen is that the Indian population in general, the cross sectional area of the aorta for Indian population is smaller than the Western population. But the guidelines that we follow for like monitoring and
Mm,
everything is the Western population. So we actually wait
right.
for a longer time, and the patient can dissect even before that. So right now they are doing a study on Indian population where they want to see what is the cross-sectional diameter or those things for the Indian
Agreed.
population.
Yeah.
So a lot of those kind of opportunities are
Same,
available.
same.
Like
A lot of things. Even in orthopedics, all the time, the bone structure of Indian females is way different than Chinese or Japanese or
right,
American, European, Africans. It's unique in a lot of ways, especially Indian
right,
female. So
and we
we
don't
are.
have any data
Yeah,
for
yeah,
for
yeah.
that.
We are. I have published one paper from my thesis about it, but that's just
Right,
one very, very small part of partial knee replacement. So
right.
the title of the paper is actually that the guidelines do not work for Indian patients. I have placed it like that. So yeah,
Nice one, nice one.
but
So see, there you go. Like even like you are a consultant at Apollo, so even like you can have like research trainees with you who can be working
absolutely.
on some of these research questions which are so
We
important.
have
So
at this moment, I have like 8 or 10 papers pending and waiting
mm,
for some good research guy to actually finalize a
come,
lot of
yeah,
things, somebody
yeah,
to do the mechanical work,
yeah,
and then it's a flurry of papers waiting
yeah,
because we see so many things every day. Somebody is
right.
collecting the data, but somebody needs to organize it as well.
Yeah,
So
so a lot of
opportunities are a lot.
opportunities.
Yeah, yeah.
Yeah, I can definitely help out if somebody's interested in general surgery and specifically like rural surgery, global surgery work. I can put you to the right resources and you guys can take it from there. And if somebody's interested in ortho, you can reach out to Dr. Naman through Delhi Docs
Perfect.
or directly as well.
Right. Thank you so much. Thank you, Manali.
Thank you.
Do you have
Naman,
anything
before
else to add? Yeah,
Yes,
yeah,
before we finish, I wanted to congratulate you on doing so well with Delhi Dogs. I think
yeah.
I have watched a lot of the episodes, and I can tell you that
Nice.
this kind of content did not exist before you started it. I think it's
Wow.
very important for a person like me also to see, 15 years down the line, 30 years down the line, what am I looking at? What are people doing at that time? What kind of life they have? So I think I had always wanted this kind of like conversation to start somewhere,
Oh,
either a podcast or YouTube. So I'm just really glad that you picked up this topic, and I hope you get like a lot of success, a lot of conversations
thank
they
you. Thank
follow.
you so much. Thank
Yeah.
you. That means a lot because you were actually the first one who went I think 20,000 views or something, your
Yeah.
podcast.
Yes. Yes, no,
Ah,
but I think these are priceless conversations. Please do continue this good work.
awesome. And I'm sure you will remain a part of it for many live
Definitely.
sessions now.
डेफिनेटली वरना तूने मुझे छोड़ी तो अपोलो में कहीं ना कहीं तो पकड़ ही लोगे तुझे.
Right. Uh,
Okay, thank
Chalo,
you everyone for joining. It's been a great session.
absolutely. And please like, share, subscribe, Daily Docs. And for now, bye bye. Bye. Bye.
Bye.